It is with great pleasure that I introduce today's guest. A native of Cameroon, Professor Boum Yap II is the regional representative of Epicenter Africa, the research arm of Doctors Without Borders. An expert in epidemiology who leads research projects in tuberculosis, malaria, COVID-19, and trial vaccines against Ebola. He is fueled with a passion of transforming healthcare in Africa and is the co-founder of iDocta and Kmerpad. He also spends his time guest lecturing and teaching graduate courses at several universities across the world.
Hello, family, and welcome back to another episode of Boomerang Diaspora. Today, I have the pleasure to bring to you one of my good friends, Professor Yap, and I'm so excited to have that conversation with him. So let's get started. Just like many of us, you once belonged to the diaspora. So today you are in the middle of a fight against diseases like malaria, Ebola, and now at the start of the moment, COVID-19. How did you end up doing what you're doing today? How did you get there? And what is your boomerang story?
Yes, first of all, I will really thank you for giving me this opportunity, but also for what you are doing. Boomerang Diaspora, I think, is a great idea. So many of us who have been out, some of us went back, others are still the other side. And to tell our stories will inspire those who are still the other side, thinking about having an impact in the continent, even without coming back, actually. But also for those in the continent to keep in touch with those who are out there. So, and I like the boomerang because it's really fit with my story. I remember I was 16 when I got what we call le bac, baccalaureate.
Yeah,
I was still 16. Exactly. In Cameroon, and I still remember like it as if it was yesterday, the last day when we were going to the airport when I was going to France for my university. And I was going with the conviction that I have to go out there, learn as much as I can, but and then come back. Because even from there, I knew that if we as privileged as we were already at that time, we had the opportunity to go abroad, it was definitely to come back and to do something different, to bring a change, to transform our environment. So this has been my drive since I left Cameroon. Now, very many years ago, that was in 1996. And I remember in my last year, my final years of engineering, I did a master in microbiology. And I had a conversation with the director of the engineering school, and then she was asking me, why are you doing that? I mean, being an engineer is already enough. And I told her that I'm coming from too far, my dear. Where we are coming from, I cannot just stop at this level. I need to do more. I need to do a PhD. I need to acquire as much as possible before going back home. And this is what I did. I did a PhD in Paris still, and also in La Jolla, in San Diego at Scripps.
Okay.
And then after that, I went back to Paris, and then I find my way back to Africa.
Excellent. So I want to transition a little bit to, some of the things that are well documented, the challenges of the reality in Africa. So it's well known that the lack of funds and the poor infrastructure impact our access to quality health. And I want to know, throughout your journey, first in Uganda, then back in Cameroon, I want you to talk a little bit about the challenges that you are facing as a health practitioner in Africa and how you're able to overcome those challenges.
No, definitely. That's one of the learning of the COVID-19. For the first time in our history, health is being put at the center of our life. Before that, it was money, it was investing in business, telecom, and quite a number of things, but nothing on health. And I've been privileged to work with Doctors Without Borders and Epicentre, which is the research arm of MSF. That's how I went to work in Uganda, where I was director of a research center for like 6 years, before coming back to Cameroon as a representative for the continent. And that gave me a very privileged position, because as an epidemiologist, you can actually see what is happening, what are the health indicator, how many people have having access to quality healthcare, and what is putting in place to respond to them. And the fact that I was in Uganda, it's East Africa,
Okay.
Anglophone, English-speaking country. Going back to Cameroon, which is bilingual, and I also work with folks in Niger, where we have another research center, which is typically francophone. And you can see a difference between the three countries. Even today, if you look at what is happening with COVID, Cameroon, we are beyond 6,000 cases, while in Niger, there are around 2,000, with 10% of them being healthcare workers. And if you go to
Wow.
Uganda, they are around 300 only after 2 months, 2 or 3 months of the outbreak, because they have managed to implement a robust healthcare system, which is not perfect, but which is
Okay.
there at least. Ideally, what do you want? You want your people to have access to quality healthcare wherever they are, which means I'm in my village, I should be able to have access to something that can take care of myself. So where we in our setting, we are more putting emphasis in big hospital where we invest a lot of money and that we are not able to maintain.
Okay.
Most of them, what they try to do is to make sure that the healthcare system at the lower levels of the healthcare pyramid, people can access at least the minimum, basing themselves on the epidemiology. Epidemiology means you have an idea of which disease you find in which place. For example, you know that malaria is killing mainly children. So if you want to provide mosquito nets, then it has to be mainly for the children under 5. So when you have those information, you are in a position now to say, okay, let me take a billion in my budget to make sure that I provide those mosquito nets to the families, especially those who are the most at risk, which has been done in different countries, including Cameroon. The humanitarian gives you a privilege to see how we provide healthcare, but with donation, with funds coming from outside. While
Okay.
the reality is also how much money are we putting ourselves as government and even as individual.
Okay.
When you want to ask someone to pay a drug for 10,000 of francs CFA, someone might tell you that it's too much. But when you ask the same person to buy a bottle of whiskey in a nightclub, it's not too much. So at some point, you really wonder what is the most important thing for us? Is it the way we appear, or is it actually our health? So definitely, this pandemic is also the opportunity to rethink on which healthcare system we want to provide to our people, and in that, our government, our philanthropists, but also our diaspora will play a huge and important role, I believe.
So if I'm a young health practitioner or even an experienced practitioner in research, an African-born practitioner abroad who is trying to come back to Africa to have an impact, to contribute, I want you to tell that person exactly some of the challenges that they will be facing trying to do their job in Africa, so that they
Yeah.
can be mentally prepared on what you're dealing with on a regular basis.
I think the first thing to do is, before you go, to have some contact, to try to develop any kind of partnership with people in the continent while you are still abroad. That will give you the opportunity to first understand the environment, because what I'm going to describe you right now is different from what someone in Niamey, in Lagos, or in Kampala will tell you, because different environment, different things. But you need to figure out, you need to get in touch with, I don't know, another professor in another university in your country, and try to engage them. I'm based in Harvard. I would like to come back. How can we start something? And you start that thing before you even go back. One, you will get to know the people, you will get to know their mentality, and you will get to know the environment where you are going. And
Okay.
once you have achieved that, then you are in a better position to start to have some small grants, some seed funding. You can go back and forth, and then slowly but surely you can figure out, if you found the best place where you can land, then good, you can make the move. And I will say, if you, like, we are talking about research, never cut the link between your university or your research organization abroad, because the research is done as a continuum with different partner. But the challenge that we face, or most of researcher, because I would consider myself as a privileged researcher. I work for an international organization, but when I work with my colleague or my student who are at the university, the first challenge is the funding. You don't have funding, they don't have the environment to have a good laboratory, to have the reagent they need, they don't have the equipment, and sometimes they are not even listened. When you look at how countries like France is responding to the COVID, they rely on the scientific committee. Here, do we really do that? Not sure. Really not sure. Okay. So definitely, you will have to be very humble to know that however big you've been, when you come back, you are just a Cameroonian researcher. So humility is really one of your main asset as you're coming back. But then you have people who manage to understand the environment, and they manage with their partnership to build some good research infrastructure. There are Prof. Rose Leke, there are Professor Wilfried Bacham, who are really I'm talking about Cameroon, who have managed to set up some research center, who are doing some great thing on malaria and many other diseases. So it's definitely possible, but it will ask a lot of humility and perseverance.
Okay, very good, very good. Doing business in Africa, there are a lot of things that you really have to take in consideration, and one of them is being humble, because things don't definitely work like they work overseas.
They don't. You know, I remember I was applying for a position of assistant at the university. That's some good years ago in Yaoundé. And I had an appointment, and when you have an appointment, then you point yourself at the time of your appointment. And it was with the dean of the faculty at the time, and then she just walked out and said, "Okay, I'm coming back." And she came back like 4 hours later and was still there. And she said, "Oh, you're still there?" I said, "Yes, you asked me asked me to wait. What did you expect?" Of course, I didn't say that. I said, "No, I'm still there. You asked me to wait." I waited 4 hours. I was very humble. And then she said, she took my file, and then, you know, if you don't do that, if you want to prove them that you are better than them, then it's pointless. Okay. I remember talking with one of my colleagues, and that was quite a learning experience for me. And she told me, you know, we've been colonized by the French and the British. We are not going to be colonized by our own people. So when you're coming back, don't think that you will come and tell people here that they don't know what they're doing and they know it all. It's not going to work. It's not, because while you've been away, the country have not collapsed. So there are things that they're doing. So you need to be very humble, to be respectful, and to learn from them.
Great
from
point.
Us, because point. Now I'm from here. So when you come back,
definitely. So speaking of that diaspora, so there are a lot of talented health practitioners abroad, and they play key roles for many organizations now. Some are even leading the fight against COVID-19. And I even read somewhere that there are more Nigerian doctors in Los Angeles than entire Nigeria. You can't help but ask yourself why Africa is still lagging behind when it comes to like skilled staff. Shouldn't we at least collaborate with those individuals, even if they're not interested in moving back to Africa? What's your take on that?
You are definitely right. It's something that we are all missing, and what we are missing in how we can actually collaborate. But you know, collaborate is the top of what a pyramid, a house, and the foundation is confidence. How much confidence do we have between those who are in the continent and those who are abroad? That's the first thing. And once we achieve that, when we have confidence on each other, then we can start communicating. When we communicate, then we understand each other's. And when we understand each other, that's the only way when we can actually collaborate. So there are some gap at each level of those four things: the communication, the comprehension, the understanding, and then the collaboration. So what has to take place is to have some platform like what you are putting in place, where you can bring together different people who can first interact without any interest. Because if you ask all those doctors that you've mentioned in Los Angeles what they can do in the continent, they will say, those people will eat my money, and and so on. But in the other hand, you also have now some people, some specialists, healthcare professional who have clinics in Lagos or in Yaoundé. They will fly from London to Lagos every Thursday. They see all their patients Friday, Saturday, Sunday. Sunday night, they fly back to London. So they've understood that there is actually not even before because they just want to help, because there is a business, there's an opportunity. So I think people should remove that mindset that all there is bad at one, but also take the risk to try small.
I like that. I like that a lot. So we love that idea of helping our own people, but at the same time, there are a lot of investment opportunities. But what would you say investment opportunities are today in the health sector in Africa?
Yeah, I completely agree with you. I believe in the concept of shared value by Mark Porters. Okay. If you really want to solve a social problem, you need to have a business model. If not, you do what most of us as NGO does. When we come, we solve a problem. Then when we go, the problem is even bigger than before we arrive.
Okay.
So definitely, you need to find a problem. And if you find those problems, there are actually opportunities. If we go back to the healthcare sector, we are going toward how they call the CSC, the universal health coverage.
Okay.
So the idea is that wherever you are, you should be able to have quality healthcare. And we think the government can do that, but it's not possible at all. So which means that if we look at the different level, what does happen when someone is sick in Cameroon? Let me take one person. If you go in Marché Central, for example, which is one of our big market, if you stand, which I did recently, I was fixing my phone. I just sat there for like an hour while people were working on my phone. And during that hour, people try to sell me all type of things. The clothes, the food, the drinks, but nothing concerning health. So just imagine that everyone have understood that the market has to come to the customer, but the healthcare people have not yet understood that. I should be standing in my office. I should be standing in the street, and someone should be able to come and tell me, how are you? Or do you want to screen your blood pressure because you have more and more people with hypertension? You want to screen your diabetes? You remember when we were young, we were seeing those young people moving with those scale to have your weight. I think we should really think about investing on taking healthcare to the people. Now I'm just thinking about the capital city, but to the most remote place. We think that those people don't have money, but they're not dying. If they're not dying, it means that when they are sick, they find the money either under the bed or wherever, and they go to the traditional healers and they pay them with something. So we have to figure out, we have to go there and say, okay, what do those people need? Do they need a rapid test? Do they need that kind of different type of drugs, different platform? I think there is a lot of opportunities and financial one to bring the healthcare to the house.
There are a lot of opportunities in the health sector, as you mentioned, and we definitely need to start looking at it that way as a business model, being able to sustain itself. Because even overseas, abroad, the hospital industry is still a business.
It is. It is a huge one.
It is a huge one. It is a huge one. I like something that you mentioned, that the fact that people in rural area or even in the cities, they're not dying because they're not going to those big hospitals. They find ways. They try to deal sometimes with traditional medicine most of the time. And I want to get your take on this, because lately there's been a strong debate, especially with COVID-19. There's been a strong push about how do we manage to standardize and leverage the traditional medicine. I want to hear your take on that, especially in the COVID-19 fight.
Before the Western people arrive in the continent, they found some people there. And those people were relying on the traditional medicine. They were not all dead before they arrived. It means that we've managed to survive. So there is something that we know how to do, which is the traditional medicine. So the challenge, and you mentioned it, is how can we standardize, harmonize it. So I work with traditional healers in some of the research that I do, and those people are also willing to collaborate. The challenge that they have, going back to the pyramid I mentioned, is confidence. There is a lack of confidence. They believe that you will take their knowledge, you will go with that, and you won't give them anything.
Okay.
Because when you talk about most of the drugs, like we're talking about the hydroxychloroquine, for example, for COVID-19, it's coming from a tree, the quinoa. So which means someone can say, okay, it's me who was the first one to start the e-cook, as you mentioned here, and now those people are making huge amount of money, and I'm still here in the village. So which means that while we're thinking about it, it's also how can we work with those traditional healers to also help them, one, to standardize, harmonize, but also seeing what they are doing as a real business.
True.
Therefore, we'll have a better quality. Now, as the COVID-19 is coming out, we have the COVID organics that you have in Madagascar, you have the portion from Monseigneur Cléda in Cameroon. How do they work? Honestly, I don't know, because the only way I know to prove that something is working is by taking different group of people. Some people take something, others don't, and then we compare.
Okay.
So which has not happened up
Okay.
to date. I think Equatorial Guinea, they are trying to assess the efficacy of the COVID organics, the one from Madagascar, and let's see what we have as a result. Because you want to make a point that we are also able to do something, but you have to do it right. If not, you harm more people than you actually want to say. I think there is a lot of investment that we have to do on our traditional medicine, and you have to put it, standardize it, and helping those people to make sure that the knowledge that they have actually makes a lot of sense, not only for the other people, but for themselves.
Okay.
So the big traditional healer should be like the big doctor with a big house in the village because he can see the benefit of his knowledge.
Okay. Interesting. And there's one thing that I wanted to ask you, like in other industries, maybe like the food industries or the consumer good industry, some companies abroad, they move their manufacturing plant in Africa, or they build some infrastructure in Africa so that it can serve the local region, right? Because we're speaking about over 1 billion people, and they figure like it'd be easier with the labor. It's easier to just logistics and do that in Africa. There, till today, we still import a lot of our drugs. When we talk about investment, isn't that like a huge opportunity out there, like for people to like start making even the regular drugs in Africa, so that 1 billion people can benefit from it, and the financial strain will not be that much since we are actually manufacturing those in Africa?
Yeah, definitely. That's really a good example where goodwill is not enough.
Okay.
Because it makes sense for everyone that if we can manage to produce drug in Africa, it will make sense for everyone. And some people have tried. I think there are 2 or 3 pharmaceutical industry in Cameroon trying to make some few drugs. Why people are not doing more than that? This is a very interesting question, and I really don't have the answer. And the challenge might be political, because for you to implement a big plant, you need to have some political support. And I think it's important to be open. I mean, there is a lot of corruption. If you have your project of 1 billion, of francs CFA, and you say, okay, let me come and put off a plant in Cameroon or in Nigeria or somewhere else, and then when you arrive and then they ask you to give 30% of your budget to someone just to give you access, what do? You run away.
Right.
You run away, and then you go and put it somewhere else. I think that's one of the main barrier, one of the main challenges, because everyone understood that there is a need. If we can produce all the drug that we need for malaria, that will make a huge difference in the price, the availability, and for the business investment. They will have a feedback, and you need also to have support from those major companies, and see what is happening in India.
Yeah.
Why can't we do what India has been doing? Why not? Everything starts and ends with leadership. So we will have the best business people. If at the top the leaders are poor, there is nothing that is going to happen. There is nothing that is going to change, because they will always ask you those 30% and you will always say no, and you will not be able to move. So as you are thinking about investing in business, in sports, in healthcare, and so on, let us also think about how to invest in politics to be able to support those who can actually push the transformation.
Correct.
This
Correct.
was my 30-second political advice.
Hey, it's all welcome. It's all welcome. And you have a great vision for Africa. And that's why you started the iDocta initiative. But I wanted you to speak a little more about that initiative.
It's a platform where we are connecting patient with health professional. And we rely on telemedicine to be able to connect and provide quality healthcare. So which means that today we have a network of, let's say, 200 medical doctors that who are all over the country, but some of them are actually out of the country.
Okay.
Because now it will be easier for me, as it happened some time back, to have a scan, which I will send to some of the people in my network abroad. They can give their feedback. So
Okay.
it has two things. First, it's improved the quality of care for the patient, but it also teach both the guy in Paris, but also the guy in Yaoundé about how to manage that patient. So you can be based in New York, you can be based in Paris, and then when we have a consultation where we need your expertise, you can consult, because now there is no borders. As far as you have a phone and a good internet communication, you can get involved. And I think that's the future. If you have a relative or yourself, you need a doctor or a nurse or any advice, you should be able to have it wherever they are, especially now. Because one of the instructions during the COVID is don't go to the hospital unless you are really at risk.
Okay.
So, which mean it doesn't mean that COVID is putting out malaria and all those diseases. You still need to have a practitioner. So, as we are talking right now, we are signing a partnership with the GIZ, that is the German collaboration, and most likely also with Doctors Without Borders, to be in a position where telemedicine can come on to support the response. Okay. So we'll be able to follow the non-COVID patient from home, but also, the asymptomatic COVID patient. When someone is asymptomatic, he has no sign or symptom, and even those who have mild symptom, they can still be at home. We can monitor them, and when we feel like, okay, now it's a bit more critical, they need to go to the hospital, then they can be transferred.
So if I were to win the lottery and were to give you 100 millions, or if someone were listening to us and then would say, okay, I'm going to give $100 million to Professor Yap, and to improve rural areas in Cameroon or in Africa, what do you think you would invest that money?
So the first thing to do, those container, when you go in everywhere in Yaoundé, you have container where people are selling clothes or whatever. Just imagine those containers being used as clinic. In every single small district or even village, you put one of them with a nurse. You put a nurse, you put a flat screen, and then you put internet. So which means that by investing into that, you provide the ability to the people all around that eye clinic to go there and to be consulted by someone who is far away. So that clinic, because also of the internet, it becomes a spot for the village. So that internet can also be used for other things. You can have on the side a library, you can have some education program, quite a number of things. So if you give me, if you give me $1 million or many million today, I will make sure that you have iDocta clinic everywhere in Cameroon and in Africa, and that will have a systemic impact.
Excellent, man. It was a pleasure, my dear good friend, Professor Yap, to have you on Boomerang Diaspora. Thank you so much. Thank you for your time, and have a good day.
Thank you very much.